Hello, everyone. I'd like to welcome you to today's session on what doctors and patients need to know, medical practitioners' role, and DTC applications. Before we begin today's session, I would like to acknowledge that I am joining you from Gatineau, the unceded traditional territory of the Algonquin Anishinaabe people. I recognize and honor their deep connection to this land, as well as the lands where each of you are joining from. The map you see behind here reflects the many Indigenous nations whose territories span across what we now call Canada. We honor them all, past and present, and commit ourselves to learning from and respecting their territories, their histories, and their cultures. A Pathway to Benefits is a project that is free. It's a national initiative led by Mood Disorder Society of Canada to help Canadians with disabilities and their families access the financial supports that they are entitled to, but too often miss out on. Pathway to Benefits is funded by the Government of Canada's Disability Benefits Navigation Program. And the views expressed here today might not necessarily represent the views of the Government of Canada. Brief introductions. My name is Diana Vince. I'm the National Program Manager here at Mood Disorder Society of Canada, and I will pass it along now to my colleagues to allow them to introduce themselves.
Hello, everyone. My name is Sherry Mayer. I'm the National Outreach Navigation Coordinator for the project across Canada.
Hi, everyone. I'm Ashley. I'm the National Benefit Navigator here at Pathway to Benefits, and I will also be the facilitator for today's webinar.
All right. So before we get started, please note that your microphones are muted and the session is being recorded. We invite you to use the Q&A function to submit any questions that you may have, and we'll address them at the end of the session. Please note not to disclose any personal health information when asking any questions. The chat function actually for today is enabled. I know it says on the slide here that it's disabled, but if you feel comfortable, you can also throw in a question to the chat. If you'd like, you can also raise your hand. We welcome, of course, live questions as usual. And a recording of the session will be shared with all registrants following the session. It'll also be available on our website via benefitspathway.ca. We will go over, as usual, for anyone that is joining us that is new, who we are at Mood Disorders, what is the Pathway to Benefits program. And of course, for today, Ashley will be going over supporting access to benefits through effective collaboration. So MDSC is a national non-for-profit organization dedicated to improve the quality of life for people affected by mental health issues through advocacy, education, and support. We also provide education and awareness about mood disorders to the public, healthcare professionals, and policymakers. We offer support and resources for individuals living with mood disorders and their families, all while advocating for an improved mental health services and policies across Canada. We promote research and innovation related to mood disorders. I will now pass it along to my colleague Sherry to go over what the Pathway to Benefits program is all about.
Thank you, Diana. So the Pathway to Benefits project is a national initiative supporting Canadians with disabilities and their families who are looking to apply for the disability tax credit, the Canada Disability Benefit. We offer information on other provincial and territorial disability support programs and services as well. As Diana mentioned earlier, the program is free, it's inclusive, and it's person-centered. We work with Ashley, who is our one-to-one navigation support person and who helps lead these webinars to help provide more information for you. And Ashley also helps with completing applications. We have an online resource hub as well on our website that's very handy, which includes a lot of easy-to-use digital tools for you. We centralize all the information that we gather on this website as well for federal and provincial benefits. We also have some trained volunteers in the project that help and support Ashley in helping to provide information for the benefits. My role is to help with partnerships across the country. So I work with partners in this project that have equally minded value systems that help support persons with disabilities in their realm as well. And we do a lot of outreach to underserved communities, First Nation communities, LGBTQ plus communities, and more. So thank you for being here today, and we're excited to share this information with you.
I'll go over a few of the objectives for the session today, and then I'll pass it along to Ashley to continue. But really, the goal today is for you to be able to understand the purpose and process of the disability tax credit, learn how to effectively document functional limitations, recognize the practitioner's ethical and advocacy role, and strengthen collaboration with patients and caregivers. So without further wait, I will now pass it along to Ashley to continue.
Thank you so much, Diana. So today in the content portion, we're going to be talking a little bit about the disability tax credit and what it is. The disability tax credit is a non-refundable tax credit offered by the Canada Revenue Agency. It helps individuals with disabilities or their supporting family members reduce the amount of income tax they owe. Please note that if you or your supporter did not pay taxes to the government, you won't get monetary benefit, as the monetary benefit mostly comes from the Canada Disability Benefit if you are approved, or which you can get even if you did not have income, or through a tax refund. The disability tax credit consists of a federal and a provincial amount. The federal amount is standard across Canada. The provincial amount will vary by province, specifically the province you live in, depending on their tax rate. The variation is because the DTC was designed to reduce tax burden for Canadians with disabilities. Since income tax rates differ by province, the provincial portion needs to adjust as well. If we could go to the next slide. Why would you apply for the DTC? As I hinted before, the disability tax credit is more than just a tax credit. It's a gateway benefit. It allows you to access funding through the Canada Disability Benefit, which is a monthly financial support for eligible individuals with disabilities. You can get a registered disability savings plan. So say you have extra money you're saving, you want to have long-term savings, the government will match it with bonds and grants in order for you to be able to save. And if you have the DTC, you're able to get this account. And thirdly, the DTC will reduce your income tax owing, and it will lower federal and provincial, as I said before, and could lead to a larger tax refund. We could go to the next slide. Perfect. To be eligible for the DTC, you have to be a Canadian citizen or resident for tax purposes, have a severe and prolonged impairment lasting or expected to last about 12 months or more, be markedly restricted in one of the following areas. And before we get to those areas, markedly restricted means you are unable to do the activity, or it takes 3 times longer than somebody of a similar age without the impairment, even with the use of appropriate medication, therapy, and devices. The restriction is present all or almost all of the time, and the restriction has lasted or is expected to last a continuous period of at least 12 months. The areas are walking, feeding, dressing, hearing, speaking, vision, eliminating mental functions necessary for everyday life, or you require life-sustaining therapy for more than 14 hours a week. If we could go to the next slide, please. So in order to get the DTC, you need the support of a doctor. The doctor's role in this is that their signature determines the access, and the words shape whether or not the patient will be approved or denied. Physicians and nurse practitioners are responsible for certifying impairments accurately and comprehensively, providing functional descriptions, not just diagnoses and medical labels. Basically describing it in everyday words and in impact statements. They are also responsible for documenting consistency across the forms and records, acting as both a clinician and advocate if the patient is denied, and describing impairments in a way that can make the difference between an approval and denial. If we could go to the next slide, please. To get to DTC, the application process is relatively simple looking at it from above. There are two parts of one form required. You require the form T2201, the certification, and then part A is to be filled out by yourself, and part B is filled out by the medical professional. There are multiple different formats of these forms. For accessibility, you can have a fillable PDF to fill through Adobe Acrobat or Preview, whatever your preferred method is. A printable PDF that you can fill out by hand and send it in. E-text for screen readers, and you can also submit the application online, where your doctor will just be sent a link to fill everything out. Other formats are also available by request so that you are able to get the disability tax credit that you deserve. So, part A is patient information. As we said before, that will include just your personal information, name, address, social insurance, etc. Part B is what the CRA will be making their decision on. And it's important to note that Part B is not necessarily seen by medical professionals, which is why it is very important to focus on impact language and specific examples. This is an example of Part B. You list any conditions or diagnosis that impair your doctor will, and then they will ask for details associated with whatever condition, including how long you've been impaired and any other information. Having documented specific examples is extremely helpful in this, as they do focus on that definition of markedly restricted. And by having specific examples that, for example, you cannot walk X amount of time and how it's impacted your life, really does improve the chances of success. Also, ensure that the medical practitioner, or yourself if you are a medical practitioner, avoids vague terms such as sometimes or mild or moderate. Really ensuring that it is clear how your impairment impacts your life. Also, make sure to use CRA language, the legal language that the CRA is looking for and how they explain it, such as markedly restricted, prolonged, cannot perform without assistance. And when possible, describe frequency, duration, and support needs in the form or secondarily in the application. When describing these, clarity, precision, and plain language are key to a successful application. If we could go to the next slide, please. So, how should doctors word the application? The important thing to know, as I've said multiple times, is that the CRA evaluates how the person functions day to day. You need to focus on the basic activities of living, the dressing, eating, walking, hearing, speaking, mental functions, and be able to specifically and accurately describe how it influences their life. For example, a lot of mistakes or common misconceptions that doctors make is that they just need to write the diagnosis and the CRA will just understand what it is. And that's not necessarily the case. For example, a doctor could just write has chronic pain, but that does not describe the restrictions or the impact that it has on the individual's life that is applying for this. And that is really what the CRA is looking for. So instead, a doctor could write, unable to walk more than 10 meters without resting due to severe pain and fatigue. It's very similar to those tips that people give you for writing a resume. Try to give numbers and your impact. So, perfect. Common myths of the DTC on both the doctors and the patients include that diagnosis guarantees approval. And as I have said multiple times, and you could probably say it with me, it does not. The CRA bases its decisions on functional impact, not medical labels. Just being diagnosed with something does not mean that you will get approved. And that is where most people need to start the appeal process, is by deciding and showing the functional impact of any limitations that you may have. Another misconception is that the DTC is only for people with physical disabilities. No, that is not the case. Many mental and cognitive impairments qualify when they significantly restrict daily life. This can include depression, anxiety, ADHD, schizophrenia, any mental and cognitive impairments that restrict daily life often can get approved, especially if it is described, the functional impact is described the right way. I do see that there's a question, and we will get to that question at our Q&A. Thirdly, if a case is denied, it's final. That is not the case. Appeals and reassessments are very common. A lot of people do not get it on the first try. Once you receive the denial, you have 30 days to file an appeal. They will give you the date on your letter and explain what they need from you. You have that 30 days to submit an appeal to get approved. After that, you will have to reapply again. I will put a little plug here. We help with appeals as well, and we would be very happy to help you if there are any issues or anything you're confused with, or coming up with a plan for an appeal. If you fill out a form, the patient will automatically qualify. Doctors often say that. But once again, diagnosis does not guarantee, and approval depends on how the information aligns with CRA criteria, which is why it is crucial to follow their wording and to describe the impact. Patients, that is why I recommend that you keep track before you're applying. If you know you're going to apply, keep track of functional limitations to tell your doctor and to have that conversation with them. And lastly, I believe, reassessments mean something was done wrong. Reassessments don't necessarily mean that something was done wrong. It can often result from policy changes or limited time approvals, or just differences in what the government sees from time to time. If you're reassessed, you can also get an appeal as well if it is taken away or anything of that sort. And the main topic I'm finding is that accurate, detailed medical descriptions prevent unnecessary delay and appeals. Perfect. Now, as I've been repeating about language, we are now going to talk about how to effectively document functional limitations. There are 3 key words that you need to remember when you're documenting this: impact, clarity, and quantify. Wording should focus on impact, not diagnosis. For example, the patient cannot do X, Y, and Z. For example, the patient cannot walk more than 10 meters unassisted and is unable to perform daily activities such as walking, cooking, and, for example, even something as simple as putting on your shoes. You don't leave it to the person examining to determine your disability and your impact. You need to work with your doctor to ensure that they are accurately describing that. The second is clarity. Plain language is the key for clarity. It's very easy for doctors to stay in medical language, as many people who have been to the doctor know. It is key to ensure that while they do describe the diagnosis, they also focus on plain language explanations such as before, just saying it out there and not expecting the examiner to understand all the medical lingo and language. The third tip is to use numbers when available to quantify impact. For example, you cannot walk more than 10 meters. That is a key finding. Or it takes you about 5 minutes to put on your socks in the morning, or it takes you 30 minutes just to get dressed. Those timings and those approximations and numbers are key to helping the doctor and the examiner understand the impact and limitations that your disability has on you, because it is very important that not only they understand that, but your disability is shown and understood the way you would like it understood. If we could go to the next slide, please. After saying all this and talking to both patients and doctors, how do we now collaborate? We have some tips and tricks for both doctors and patients for effective collaboration when filling out a disability tax credit application, or essentially any government benefit application, because most of them are looking for similar language. If you are a patient, bring a written summary of daily limitations. Write that it took you a certain amount of time to get dressed, a certain amount of time to walk from place to place. You had difficulty doing this. It's very difficult to do so, but it is key for not only understanding disability, but also for your doctor to describe this for the disability tax credit. By having a little, for lack of a better term, diary, it opens up a lot of different options when it comes to this process. Secondly, ensure that all your reports are shared among your medical professional. If you have any specialists or you go to multiple doctors, make sure that all your doctors have access and that the doctor that is filling out your medical information is accessing all of it. Make sure that they have access to all your medical information and that they not only describe it in medical terms, but also in plain language, and that you can have effective communication between all of them. And lastly, communicate clearly about what daily life looks like. Make sure you tell your doctor about any difficulties, any different tasks that are difficult, even if they're not in the CRA requirements. Any information you can give your doctor is good information if you have a good doctor that you have a great relationship with. And for physicians, make sure you schedule adequate time for form completion and make sure that you can fill out the form accurately and with the description that is most likely needed to get it approved the first time. As I said before, use plain, accessible language and engage the patient as a partner in the process. The patient is the one living with the disability. They have the lived experience and the access and the understanding in order to help you accurately define it. Do not just explain the diagnosis, explain how they live with it. And document this consistently across records and notes, ensuring that any other medical practitioner that is working with the patient understands this, especially if a specialist is needed to fill out the form, or say a nurse practitioner in your practice. Because collaborative documentation is key. All right. We can go to the next slide now. We have a few commonly asked questions that we will go through before our Q&A. The first commonly asked question is, how do I bring up the DTC with my doctor? Assuming that you have a positive relationship with your doctor, which we understand is not always the case, you can bring up that you are interested in the DTC because of your limitations in whatever your limitations are with your disability, and that you believe that it would be a benefit to you, and ask them what their experience is with the disability tax credit. Throughout this process, it really should be a discussion between both you and your doctor, and it should be collaborative the whole time. And the next question is, how am I supposed to tell my doctors how to fill out their side? Really, all you have to do is explain your limitations and explain to your doctor that you understand that the CRA expects them to put the diagnosis and everything, but just explain that you would like your experience heard and that you've heard that that increases chance of approval. And most of the time, if you tell them that it increases their chance of approval on the first try, neither side wants to be completing forms all the time, and that will work. But if you have a negative relationship with your doctor, it's going to be much difficult to do so. And in that case, it is crucial just to be very direct with your doctor on what you want. And both of these last questions are really a matter of advocating for yourself and explaining very succinctly and positively about the disability tax credit, how it influences you, why you need it, and how you meet the criteria. Third, what do I do if I don't have a family doctor? This is something that comes up all the time when we're discussing the disability tax credit. And it's a very common reality for a lot of Canadians today. If you don't have a family doctor, there are a few different avenues that you can take. First of all, if you have a specialist, check the list that the CRA gives you of who is able to fill it out. See if they're able to fill it out and let them do it. It does not just have to be a family doctor. It can also be a nurse practitioner. You can also, in some cases, go to a walk-in clinic or in many cases, there are online, for lack of a better term, walk-in clinics and online doctors that you are able to see through your provincial health insurance, which will allow you to upload the forms and gain a relationship with that doctor to help you with that. Many of them will, some will not. If you don't have a family doctor, it's a matter of just trying different options. The last question on the slide is, does my doctor decide if I get the DTC? No, your doctor does not decide if you get the DTC. It is an external examiner for the CRA. People at the CRA will look over your application, look over what your doctor said, and make a decision based on their requirements, which is why it's important that even if your doctor says you're not eligible, if you believe you meet the requirements, it is worth at least to try and is worth it to advocate for yourself, because your doctor does not make that decision for you. The CRA will. And even if the CRA rejects your application, there are still options for appeal and reapplication that we can go through in specific circumstances. If we can go to the next slide, please. All right, perfect. We are now at the Q&A portion. Feel free to raise your hand or write in chat or write in the Q&A any questions that you have. I do see that we have one question from Denise already in the chat, so I will start with that and let the rest of you ask some questions while I'm answering this. Denise asks, can a veteran already receiving the VAC benefit for the disability apply for the DTC? And the answer to that is yes. No matter what benefits you already have, if you are eligible for the DTC, you are able to apply for the DTC. As far as we are aware, there is no requirement to not have a specific benefit. The DTC is available to anyone eligible.
I do see another question, Ashley.
Yes.
This is from Sina. Sorry if I'm pronouncing your name wrong, Nahua. Is there any help for people with cognitive issues to do paperwork?
There are. If you are looking for somebody in person, we do not do that as an organization, but if you're looking for somebody who is able to help guide you through it, tell you what line goes where, and guide you that way, we are able to do so. But in your community, there is often community legal clinics and other nonprofits and organizations that might be able to help you. I often recommend looking that up online, because a lot of communities do have places that people can go, make an appointment, get forms filled out themselves if you do need somebody there sitting next to you to fill it out for you. But we do provide navigation through the forms and can tell you about the forms. We just do not fill out forms ourselves.
I believe there is from the same individual something in the Q&A. If you are using someone other than a family doctor, how are they able to comment without history? First time I asked a doctor, was flat out told I don't qualify. Asked again after receiving a handful of new diagnoses. Actually, I asked if I used a service to complete the form, if doctor would sign off, if she agreed. She said no. I can do that for you. She said, no, I can do that. I think you meant to write, I can't do that for you. I've been doing it for years. Asked her approval rate, she has no idea. So now the CRA is saying they need more info, but won't say what they need.
I'll answer your first question, and then I believe the rest would benefit from a one-on-one conversation with us. So feel free to call and we can have a discussion, or even email, text, or I believe our chat will be up soon, but calling, emailing, and texting right now are other ways to contact us. I would highly recommend you do that because that is something we can work on together. But as for your first part of your question, if you're using someone other than a family doctor, how are they able to comment without history? It depends on the doctor. A lot of doctors will ask you your history and will go off your word and will understand the limitations. And some doctors will listen and understand everything and fill it out. But other doctors, as you described, are not so connected, we'll say. And in that case, it really is a chance you have to keep trying to find doctors that will listen to you. This can be an online doctor, and make sure you just see them for a few appointments. I know in some provinces this is difficult if you do have a family doctor, and I will note that in some provinces, if you see other doctors, for example, at a walk-in clinic or on the online doctors through your provincial health insurance, that you could get derostered and have negative consequences with your doctor due to funding structures. But I really would recommend that you just describe it and start listening and working with that doctor if you are working with one that does not have your history, because there are doctors that will listen and will understand your history based on your word.
I don't see any other questions. And then maybe until they trickle in, we can go through a few of them that Ashley, you and alongside other members have experienced. I know that some of these questions even takes me back to when I was at a conference. I was approached by a few doctors that had a few things to say. And I was really approached by a lot of people. But one of the most common ones was, as you said, it was who can help me fill out the form, but also who can sign off on the form. Those were the most common ones.
The CRA has a specific list of doctors online that are able to fill out the form. Specialists are able to fill out the form depending on the limitations, but doctors and nurse practitioners can fill out for all limitations. So it is best to use a family doctor or a nurse practitioner if you have multiple disabilities that you're applying for. If you're using a cumulative approach to the disability tax credit, since they can sign off on all of it instead of going to your psychiatrist and then your physical therapist and going between different specialists.
And it's really great news, I think, to anybody who's joining us today that nurse practitioners are able to do this. It's a fantastic addition to have, I think.
Definitely. And then some other commonly asked questions we'll go through while we're waiting for some questions is, what if my doctor says I don't qualify? First of all, in this case, you are your best self-advocate. You need to advocate for yourself and explain to your doctor what the impact is and that you understand the CRA requirements and describe exactly how your disability impacts you. And if your doctor will not fill out the form, then you can go to one of the specialists listed on the CRA website that are able to sign off and fill forms. But as I said before, it is best to advocate and to really work with your doctor to get them to fill it out. Another commonly asked question is, do I need a specialist to fill out the DTC? And the answer is no. There are certain specialists that can fill it out if your doctor cannot or will not, but you do not need specialist visits and you do not need a specialist opinion to complete the DTC. Another question I commonly get asked is, do I have to fill out the forms and why? Do I have to pay my doctor to fill out the forms and why? And the answer is yes. Most cases, your doctor will ask you to pay for you to fill out the forms. In many cases, it can be about $50 to $100. It depends on the doctor's offices because they set those rates. And the answer to why is they are paid for your appointment, but not for the extra time filling out these forms under the funding structure. So they are needing to get paid for their time. If you are on provincial benefits and need these forms filled out, often the provincial benefits will reimburse you if you talk to your caseworker. Or if you can't afford it, you can also have a conversation with your doctor about different options for them filling out the forms. And some doctors might not even charge you to fill out the forms. It is very dependent on the practice and the doctor. The last question is, what if the CRA denies me, even though my doctor filled it out well? In that case, the CRA will tell you what you need to appeal. And if they don't, you can call us and we can help you navigate that. But also, you can send medical records and have your doctor or another doctor write a letter explaining your limitations and start the appeal that way. You can always appeal if you are denied within 30 days. Otherwise, you can reapply. Nothing is stopping you either way because you should get the disability tax credit and any other benefits you deserve, and you should not miss out on them. The last two questions. Does mental health count for the disability tax credit? And the answer is yes. I've said it before, but depression, anxiety, bipolar, ADHD, any mental health or cognitive disabilities count for the DTC. All you have to do is meet the requirements of restricted, that it takes you longer to do certain things and that it significantly impacts your life, which it does, and you can get the DTC. It does not matter what type of disability. For a mental health, you can have your doctor or your psychologist fill it out, but you can definitely get the DTC. Does my doctor need to submit medical records? And they often do not need to submit medical records, but in some cases, it can be important to submit it, especially when you're in appeal. But if you do not need to do an appeal, you get approved the first time, no, they do not need to submit medical records. And I just see that we have a couple of questions that just trickled in.
One of them is
Okay.
is a comment. I'll read it out loud, but
Okay.
from Sina, it was saying it's difficult to advocate for yourself when you're already off work because you can't function in the first place. Um, so of course that, that is something that we are extremely understanding of. If there's ever any way that we can help you, even with some methods to advocate for yourself, then I urge you to give us a call, and we'd be more than happy to try and work through those avenues with you, alongside you. There is another question in the chat. Can I apply for the DTC if I am turning 65 next year in February 2026?
Yes, the disability tax credit does not have a age limit. The only age limit is any of the benefits that you can get with the DTC. But the DTC itself does not have a benefit, it does not have a timeline or age range that it requires. So you can definitely apply and still get the disability tax credit.
Okay. I don't know if there's any remaining questions. I know that we are 10 minutes out. I would like to mention that I'd like to thank everybody who took the time to join us today. Of course, as usual, there will be a recording that will be shared with you and with all registrants that were unable to attend today. I left a feedback survey in the chat. We always really value your feedback and love to hear what you think about our sessions. And I've also left in the chat an invitation for you to join us in about 2 weeks before the holidays. We'd like to squeeze in another session that's going to be held on December 4th, same time, so 12 to 1 p.m. Eastern Standard. And it's going to be on accessibility and equity in accessing disability benefits. So we'd love to see you there. I don't think that there are any more questions. I don't see anything coming in. Once again, thank you so much. We urge you to visit our website at benefitspathway.ca or call us at 1-888-975-9990 or email us at info@benefitspathway.ca. I'd like to also thank my colleagues for joining me for these webinars, and I myself, along with my colleagues, thank you so much for joining us today. Thanks, everyone.